This visual mnemonic presents the mechanism of action of anti-seizure drugs, a crucial aspect of neuropharmacology. Recall, in our previous video, we introduced and classified anti-seizure drugs. In this video, we'll picturize the mechanism of action of these drugs. Next, we'll discuss the pharmacology of specific agents and their clinical use. In this video, we'll discuss the pharmacology of carbamazepine. First, we'll talk about the pharmacology of the drug, then associate each key feature with this image to facilitate recollection. This scene takes place in a car factory. Car rhymes with carbamazepine. This should help you mentally associate this mechanism with the pharmacology of the drug. First, let's talk about the chemistry of this drug. It is a heterocyclic compound similar to phenytoin and possess an urido moiety NCO-NH2. Car on wheels should help you remember its heterocyclic nature, and the digital sign in the image clearly shows the urido moiety. Next, we'll talk about the pharmacokinetics of the drug. Although it is not illustrated in this image, it is important to know that for carbamazepine, like phenytoin, gastrointestinal tract absorption is almost complete in most patients. Peak plasma levels are achieved within 6 to 8 hours. Again, the digital sign in the image clearly illustrates this. A chalkboard at the back of the factory, where the total production number for the day is highlighted for quality control, symbolizes the half-life of this drug, which is 36 hours. It has a volume of distribution of 1 kilograms per liter and approximately 70% bound to plasma proteins. It is completely metabolized in the liver and excreted in urine. For the purpose of this video, the dog in this image will symbolize the liver metabolism, and the urine around the dog's feet will symbolize the drug's excretion in urine. Notice the young boy's jersey has the number 10 on it. This is to help you remember that the metabolites carbamazepine 1011 epoxide have anti-seizure activities. Next, we'll discuss the mechanism of action of this drug. Recall from our introduction video, this sodium room represented the inhibition of sodium channels. The toy car the little boy is playing with symbolized carbamazepine. One of the mechanisms by which this drug acts is that it blocks sodium ion channel and inhibit high-frequency repetitive firing in neurons. It also potentiates postsynaptic action of GABA, thereby interfering with synaptic transmission. Finally, it inhibits uptake and release of neurotransmitter from brain synaptosomes. The clinical uses of this drug include its use in the treatment of simple partial, complex partial, and generalized tonic-clonic seizures. Next, we'll discuss the adverse effects of this drug. In this scene, we see a man drunk to stupor and unconscious. Stupor is one of the adverse effects of the drug, and his unconscious state symbolizes coma, which is also an adverse effect of the drug. His wife walked in on him in this state. She's extremely cross, irritated, and is yelling at him even though he is unconscious. This symbolizes the confusion and hyperirritability that may be caused by this drug. Next to the drunk man, his son is seated on the couch. He took some of his father's drink when he got knocked out, and now he's retching continuously and looks like he's about to puke. These actions symbolize that with this drug, GIT disturbances such as nausea and vomiting can occur. The little boy is holding a glass of water, which he has been drinking since he started experiencing discomfort. This points to the possibility of water intoxication and hyponatremia as adverse effects of the drug. The red and white balls on the floor in the room symbolize hematological abnormalities, which include aplastic anemia and a granulocytosis. From long-term use, this drug can cause CNS effects, such as drowsiness, vertigo, blurred vision, diplopia, and ataxia. The little boy wearing glasses symbolizes blurred vision and diplopia. As you can see from the image, the man is stretched out on the chair and cannot stay awake. This represents the drowsiness that can occur with this drug. His legs are flung in an unusual manner, and this symbolizes ataxia. Thanks for watching. Don't forget to like and subscribe.